Welcome back to the MedEdit podcast, your go-to space for evidence-based medical education.
And the only podcast where two board-certified physicians explain spooky medical mysteries.
So today we have a fun episode in honor of Halloween, which is when this episode will be airing.
We are talking about some spooky medical mysteries that are really very much founded in medicine.
You're listening to the MedEdit podcast.
Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the MedEdit podcast.
All right, today we are diving into chilling cases from the world of medicine, where doctors become detectives, patients defied explanation, and the human body revealed its strangest secrets. So grab a flashlight or maybe keep the lights on, because once you hear these stories, you may not be able to sleep tonight.
This is going to make me laugh the whole time. Okay, so case number 1, the woman who couldn't step into the light. It began like something out of folklore, a woman who could not go out into the sun. But this wasn't a vampire myth. It was a real patient who arrived at a clinic complaining of burning skin, violent blisters, and even disfiguring scars every time she stepped into daylight. Doctors first suspected a rare allergy, maybe some kind of chemical sensitivity, but then they tested her blood. The woman had a condition called porphyria, sometimes known as the vampire's disease. Porphyria is a group of metabolic disorders affecting the heme biosynthetic pathway. Heme is used in the creation of hemoglobin, the protein found in red blood cells that is responsible for transporting oxygen through the body. Because of this alteration, she would get a buildup of porphyrins, light-sensitive chemicals in the skin, causing symptoms after sun exposure. The result? Her skin literally burned in the sunlight. Even stranger, in medieval times, people thought these patients were drinking blood because their urine was so dark, part of the disease presentation. Also, changes in the skin and gums led to an appearance of fangs because of the receding gum line, reinforcing that vampire image. Lastly, as for that whole garlic aversion you would hear about with vampires, well, it is a high sulfur content, which makes it a potential attack trigger for people with some acute forms of porphyria. So this was no myth. This was real medicine. And while modern medicine does have some treatments for porphyria, the woman's condition reminded her doctors just how thin the line is between superstition and science.
Absolutely. And I feel like in general, a lot of historical things get blamed on porphyria, which I find funny considering how rarely I feel like we see it. Yeah. But it's like anytime anybody went crazy in history, like, oh, it's probably porphyria.
Probably.
You know, it's like Nero burning down Rome and all these things. And it's like vampires getting started, a whole lore of vampires created, you know, based on certain disease presentations. And I just think it's insane because it really is medicine that we get taught, rarely see, that is huge in folklore.
I mean, it's always the like really rare zebra things that get all the most interesting stories about them, or the things that you're supposed to always just rule out as a physician and you're never hopefully really going to see very much of.
Yeah, but like where's the cool folklore story about diabetes?
Yeah, I know,
you
right?
Like a whole species of people that was created.
That was a whole morning
and
today.
They were diabetic.
And they I wish I could have done that. Like every patient this way, like saw like 16 in a row. I'm like, and they're diabetic.
Yeah,
like,
exactly.
It was no longer exciting.
Mystery solved, you know? It's never like that. It's always something really crazy and cool and unique.
Yeah.
So
I wish I could get that one.
Yeah. Well, now you can for the rest of the day. You still have a chance.
Yep.
So our next story, also very interesting. So we call this one, case number 2, is the corpse that moved. All right. So we all know hospitals are a place of healing, but sometimes they are also a place of fear. It can be pretty scary for people. Well, for a specific woman in 2014, a 91-year-old in Poland, she was, well, first off, pronounced dead at her home. Okay. She was elderly, had some medical problems. You know, her family went to check on her. They didn't think she was breathing and they just thought she was really cold, ice cold. You know, to set the scene, this is Poland. This is winter, which in my head feels like it's going to be cold. You know, maybe there's a window cracked somewhere. She had dementia. Maybe she forgot, you know, to put on the right clothing or something like that. And she also had, again, some medical conditions. Maybe she had diabetes or something like that as well. So, I guess at this time, what you do is you call your family doctor. They come to your house to check on you and to declare you dead if you are. So that's what happened. Her family doctor came to her house. They said they couldn't detect a pulse, didn't really notice her any breathing. So they pronounced her dead. So they called the appropriate people. She was zipped into a body bag and she was taken to the morgue where she was left on a table to be dealt with, you know, later that day. Well, several hours later, as you can imagine, being the staff person working in the morgue, and you start seeing this bag moving around that's supposed to have a dead person in it. So literally her quote unquote corpse was moving. which would have terrified the crud out. I would have run. I probably wouldn't have even opened the bag. I would have run because I would have assumed they had vampire disease and that they had just been reincarnated. Well, so what they think happened is the woman had suffered from accidental hypothermia, which occurs when the body is releasing more heat than it's absorbing or it's generating. So her body temperature had dropped so low that her pulse basically became nearly undetectable, which from what I read really only has to be like a moderate hypothermia. It doesn't even have to be that severe to get you even, less than 60 beats per minute, closer to 40. Obviously, the more severe it is, the more, bradycardia or low heart rates you can get. And so she seemed like she was clinically dead. But hours later, her body's in a bag. It's slowly rewarming, back up to a normal temperature. And as it did this, her heart rate probably increased back up. And then she again, regained consciousness. Now, I will say she was demented, but they didn't ask her about it. And she said she really just felt like she woke up and didn't recall any of the events that had happened. So she didn't recall at home, like, quote unquote, falling asleep / dying.
Well, she's like asleep.
She's asleep. Yeah, exactly. Yeah. She basically just woke up and like opened her eyes and she's inside of a bag and started moving around. So I thought that was pretty interesting. And this overall phenomenon is actually something that we utilize in medicine with certain conditions, such as after a cardiac arrest, or even with infants is something called HIE or hypoxic ischemic encephalopathy. And we actually cool them intentionally to specific goals to try to reduce damage to the brain. We like to use the term therapeutic hypothermia because it's not accidental, but very specific protocols on how we cool somebody down and how we warm them up. This is also why we are taught in med school that you do not pronounce someone dead until their body has been rewarmed to a near normal temperature, right? You're not dead unless you're dead and warm, right? Like that's what we're taught for that specific reason. Because until you are, those vital signs can be a little bit tricky and difficult to interpret.
That's, I think, one of the things you hear about pretty often, pretty quickly on your rotations when you do emergency medicine, ICU. I mean, it's drilled into you that the body has to be warm.
Right.
Absolutely.
Exactly. Well, I guess in 2014 in Poland, when it was winter outside with the window open. Yeah, exactly. And make sure you have a normal body temperature before you tell the poor 91-year-old's family that she had passed away.
Yes.
Can you imagine that family getting that phone call and be like, okay, we got to come pick her back up now because she's not dead and she's ready to go home and have some tea, she said, which is apparently what the newspaper article actually said she wanted.
She wanted some tea?
She wanted some tea.
Oh,
exactly. She's like, can you just get me home and get me a blanket and tea, please?
Oh, sweet thing. Okay, so we move on to case number 3, when the body turns against you. We like to think of our bodies as protectors, beating hearts, fighting immune cells, breaths that come without thought. But sometimes our body turns traitor. Its defenses misfire, and what should keep us alive tries to destroy us. There was a story published in 2008 out of Australia about a 14-year-old named Ashley Morris who loved swimming pools until she suddenly couldn't go near them. Her skin erupted in burning welts after every shower. Raindrops felt like acid. Even her own sweat caused searing pain. Doctors were baffled. After rounds of tests, they delivered the diagnosis: aquagenic urticaria, a condition so rare that there are only about 50 reported cases. To put it simply, Ashley was allergic to water. Some experts think this could be due to an allergen or chemical in the water the body is allergic to rather than the water itself, or an interaction with water and something already on the skin. In Ashley's case, it was hypothesized that her histamine levels may have become chronically elevated as a result to a medication exposure. But again, this was only their hypothesis that was listed.
Yeah, I saw there wasn't a whole lot of reporting. I mean, the like reputable reporting. So there, had mentioned in a few places that maybe she'd had a specific antibiotic exposure that had caused a chronically elevated histamine level and just caused that reaction with water specifically. But I couldn't really find any medical evidence on that. So I said that's why it was a hypothesis. But in general, with aquagenic urticaria, a lot of times it can be something that you are exposed to that causes histamine level raises and then just continues so that you present allergically to other things.
I mean, I've definitely seen ones that have had, urticaria from, cold exposure. Right. There's certain things like that are maybe a little more common. I don't think I've definitely never heard of anybody with water specifically.
Well, if you had, you should have reported it because it's only 50 people. So you should be writing it up if you do get it.
Poor Ashley. And now she's just going to be known nationwide, even on our podcast, as the girl allergic to water.
Well, and she had done several articles, like follow-up ones as she'd gotten older. So starting at 14 and then even when she was, older for whatever she did for a career, some basically talking about how that affected a lot of different things. So overall, very interesting interesting story, but thank God I'm not allergic to water because that just sounds horrendous.
It does, for sure.
So this one blurs the line between fairy tale and fact. The story of a man whose unusual appearance made him not only a living curiosity of Renaissance Europe, but some say his life inspired Beauty and the Beast. His name was Petrus Gonsalves. In case you want to Google it for more information. So from the moment he entered the world, it was clear he was different. His entire face, body were all covered in a thick coat of dark hair. What Gonsalves had was a genetic disorder that's rare called hypertrichosis, also sometimes referred to as werewolf syndrome. Congenital generalized hypertrichosis is more of a group of conditions that phenotypically or how they present to you, obviously, can be similar, but genetically they may be separate disorders. So they all look like they have increased hair as the presentation, but the genetic problem that caused that could be different depending on what disease you're talking about. So we think in general he likely had a genetic disorder, resulting in dysfunction of the proteins that are involved in the development of the hair follicle. Because really your hair follicles go through periods where they are active and then where they are quiet. That's why we get hair growth in certain places on our body and not others. And so when you have some of these genetic disorders, it basically just keeps producing all over the body, which, shouldn't happen. And that's why they present with this overall almost fur appearance. In general, this is rare. This group of genetic mutations is rare, and most causes of hypertrichosis are actually acquired as a side effect of a medication or related to another disease. And I do definitely say if you want to hear a sad story, to Google this man's life story because it was really sad overall. Like he did get married, which is what Beauty and the Beast came from. Had some babies, some of which had hypertrichosis, some which didn't. But apparently they shipped the babies off to other courts as basically sideshow freaks, apparently, for other dynasties in Europe. It was kind of sad, but anyways, really interesting case to read about. And speaking of the side effect of medication, just to kind of relate this more to modern day medicine. So in 2019, there was an outbreak of hypertrichosis reported in a specific region in Spain. And all of the headlines read, Spain werewolf syndrome child cases linked to wrong drug. So in general, what happened is 17 babies developed abnormal bodily hair growth after they were prescribed and were supposed to be given omeprazole for gastroesophageal reflux disease, which is very common in babies, but unfortunately was contaminated with an alopecia hair loss treatment called minoxidil.
Oh, no way.
So these parents are bringing these babies in and they're their eyebrows are huge and bushy and they're growing hair all over their body and trying to figure out, they're running these tests to figure out what it was. And it all came from one specific manufacturer. And apparently whatever the omeprazole was actually contaminated with this medication.
That's terrible.
I know. Could you imagine being a new mom and being what is happening? Why is my baby growing hair in weird places? And interestingly, I just Googled a follow up on this because I was interested to know if they lost their hair after they stopped. So apparently some did, and it definitely diminished. But apparently some parents reported still an excessive amount of hairiness in certain areas. So I don't know if that was because of the medication exposure or they would have been anyways. But I just thought that was really interesting. So, a Renaissance Europe to mostly modern day Spain, kind of looking at the overlap there between genetic and then also side effect is, werewolf syndrome sounds like it'd be something obsolete, but still very relevant in today's medicine.
So I saw on Instagram a reel the other day that a dermatologist was doing a little stitch with. And it was talking about a girl who was talking about taking oral minoxidil, and she was showing her hairline here. And so I guess she was very young. So I'm not 100% sure why she specifically was taking it. But she was talking about how she was growing hairs down her forehead towards her actual eyebrows and on her cheeks and her neck. And so she was just, telling Instagram how horrible this is. And then of course, the dermatologist is okay, this is a known side effect.
It's a known side effect.
This is a very known side effect of the minoxidil. And so it is something if you're going to take some of these medications that do help with regrowing hair, you're not always controlling where the hair growth is going to be, right? You're going to get it kind of all over. There's a lot of dermatologists that will even do microdosing of minoxidil for hair growth, but sometimes you can even microdose it for acne. There's some different ways that they could use it, but you've got to know that just because you want hair to grow in one area doesn't mean that it's not necessarily going to grow in other places as well. And so she was pretty frustrated.
Yeah.
I think that there could have been some better counseling probably from whoever prescribed that for her.
Sure. Yeah, especially because I think the other thing people don't know about too is they get hair loss sometimes before hair growth. So that's also a big thing with some of these, regrowth treatments is you'll actually get an increase in from lost before the growth starts. So make people aware of that also. But I don't think anyone expected it to be in their babies omeprazole.
No, and that's a horrible. Obviously,
I don't think that would have ever come to mind for me.
No, I don't think so either. Poor babies. I mean, I mean that's just going to get people freaked out about like their medication being contaminated, and obviously that's
rare.
That's rare. That's
not
that
saying.
happens.
Yeah, exactly. And in general, especially in the United States, our medications are very stringently, would you say quality controlled?
Yeah, I mean, that is, we talk about things like the FDA and the benefit of them. That is one of the benefits, is that they have strict quality control measurements and things that they have to fit into. That's the thing about the whole, big pharma. Everyone's anti-big pharma. We get it. We're anti a lot of things too, but they are really tightly regulated industry.
Right.
And so when it comes to things like this, especially in the United States, we should have a really tightly regulated industry, avoiding things like contamination, making sure the product is what they say it is, making sure it actually works in the way it say it is. I mean, we're not going to go down this whole path because, there's questions about like big pharma, big wellness. The wellness industry stuff isn't FDA controlled. It isn't regulated in those ways. And so we don't have a way to make sure that what you're getting is 100% what they claim on the bottle it is.
And I think it's really great too. I don't know, a lot of people realize that for really severe side effects, we as physicians have places we can report this so that trends do show up very quickly, like in the case we just mentioned, and can be intervened on.
Right.
And that's very helpful. So that way, if there is something like a contamination issue or a side effect issue, and they start seeing it in clusters, for example, then again, they can intervene a lot more quickly. And so that's also something, I don't know if a lot of people realize that is part of our job, is basically if we do see something that is strange and unknown, and reporting it, because that way that's how they track it, and they do take it very seriously. And that's why sometimes you see these things issued where it's like recalled or this and that, something's been contaminated, and it's because people have reported it and they've seen an abnormal cluster. So again, not very common, but that's why we have the regulations that we do. Absolutely.
And I think that was one thing that you said too, with that regulation. I mean, that's only going to get better and better with time as well, right?
Yeah.
We're going to have, with advances in AI and all of those things, it really does help us so that we can get better regulation and better quality control, rechecking things over and over, evaluating those clusters that pop up. It's just more data, right? Just more data we can collect, the better options we're going to be able to create and trend those.
Yeah. And I think about how far we've come too, because if you want to talk about something interesting, historically, as you think about like the thalidomide exposure epidemic and about the limb growth issues that happened with that. And, in general, it took somebody noticing a cluster of trend. We didn't have the reporting mechanisms that we do now. And at least in the areas that it started, talking about in Europe and things like that at this time, we didn't see as much of it here in the United States, but, more overseas, that it took, longer than we probably would have liked for those clusters to show up, because reporting was not streamlined like it is now. And you had to have a lot of babies who ended up having those deformities before it was really realized a side effect of the medication. So just interestingly, we've come a long way, and that's why we take it so seriously, because we don't want to avoid things like that happening.
Yeah.
All right. For our next case, we're going to call it the Rye and the Witches. So we're going to go back to 1692 to a quiet Puritan village of Salem, Massachusetts, a town that would become infamous for the accusation of witchcraft, a hysteria that ended in trials, imprisonments, and executions. But what if the so-called witches weren't really possessed by the devil at all? What if the culprit was a fungus?
Ooh.
All right. So in the winter of 1692, young girls in Salem began to exhibit strange behavior. They started convulsing, screaming, claiming to see visions, and crawled on the floor like animals. Doctors at the time had no explanation except for one: the girls must be bewitched. So accusations spread like wildfire. Neighbors accused neighbors. Fear consumed the community. And by the end, 200 people were accused, 20 executed, and one man pressed to death under heavy stones. But centuries later, scientists began asking, what if there was maybe another explanation than what they thought at the time? So enter ergot, a fungus that grows on rye and other grains, especially in damp conditions. When ingested, it can cause ergotism, which is also known as St. Anthony's fire. So that's the other name people like to use. And what do those symptoms include? Okay, well, they are muscle spasms and convulsions, maybe some tingling, burning sensation of the skin, hallucinations, delirium, and in very severe cases, gangrene. Sound familiar? Convulsions, hallucinations, strange behaviors, the very symptoms that were reported in Salem. And here's the twist. Rye was a staple grain for the Puritan settlers. The year before the witch trials, the weather had been unusually wet, which could have been the perfect storm for something like this to grow. So in the 70s, there was a book that came out, and the theory that maybe some of this proposed behaviors was actually ergot poisoning. And this explained the entire, mysterious entity that was the Salem witch trials. There was contaminated rye bread that could have triggered mass symptoms, which is misinterpreted through the kind of rigid religious constitutes of the time to be demonic possession. In truth, maybe the girls weren't witches and they were just poisoned. That's what the theory in the 70s that kind of became popular. There has been a lot of criticism for that theory, though. So it's not perfect by any means. Some critics argue that usually would cause much more physical symptoms, like potentially the gangrene and the death. And none of those were really ever recorded in Salem. So it's like you saw some of the symptoms, but not others. Others point out that not everyone who, ate the bread became affected. So some people didn't have any symptoms. And the assumption would be that the rye was serving the entire population. So only some people got symptoms and others didn't. And a lot of people just in general think that the witch trials were much less about medicine and kind of more about some social tensions, land disputes, religious issues, maybe some misogyny. In other words, ergot may have sparked the fire, but human fear and power struggles really, fanned the flame of this case for sure. So it was definitely a popular theory that's out there when you're talking about spooky medical mysteries, whether ergot poisoning can cause these kind of mass hallucination. But in this specific case, it has a lot of criticisms, and I think overall have been somewhat debunked as the cause for the Salem witch trials.
I think I would like to think it is. Like the nerd inside of me would love to think that this is just all ergot poisoning. Yeah. It could be something very easily explainable in that way, not justifying what happened to these people, right. But I would love if that was the case. I feel like that sounds a lot more innocent than the actual.
A lot more palatable, for sure, if that was the case.
Absolutely. And it just sounds cool science, right? Like things like that can happen and explain historical, episodes that have happened in the past. So
I would think in general, just like as a GI doctor with almost any poisoning, especially with like a fungus, I would assume there'd be a lot more GI symptoms.
Well, maybe there. I mean, that's the other thing.
Nobody reported mass diarrhea.
No, they didn't.
Or mass vomiting, which in my head seems like that would have been something that was also reported, but
it's true.
Maybe not.
True. So I mean, so some of these things we bring up, yes, it has this like folklore to it that we bring up for this purpose in the episode, but clearly there are some caveats to some of this too.
Right. And that's what I say when history muddles medicine sometimes, because there's a lot of other issues that were going on at the time. And so there's always a little bit of truth maybe hidden in there. But sometimes it's got so much, folklore and myth behind it, it can be hard to figure out the truth.
Absolutely. So here's another case. This one's called The Girl Who Forgot to Breathe in Her Sleep. So it sounded like something from a ghost story. A child who was perfectly healthy while awake, but who nearly died every time she went to bed. So according to this one that we pulled out, in the late 1990s, doctors in Italy were describing a young girl who would turn blue at night. Her parents thought it was sleep apnea, but tests showed no airway obstruction, and instead she simply stopped breathing when she drifted off. So the actual culprit is something that we do know what it is. It's called congenital central hypoventilation syndrome, CCHS, sometimes called, I'm going to pronounce this wrong, Ondine's curse. The name comes from a European folklore. Ondine, a water nymph, cursed her unfaithful lover so that if he ever fell asleep, he would stop breathing.
And harsh.
Yeah, right? So this is where that folklore comes in. But at the same time, the congenital central hyperventilation syndrome is a rare genetic condition caused by mutation in a very specific gene called the PHOX2B gene. It disrupts the brainstem's ability to regulate breathing autonomically. So we sit here and can breathe in and breathe out while we're awake, while we're asleep, without really having to think about it. And I don't know if you're like me, where sometimes you all of a sudden start thinking about it, and then you're like, oh my gosh, am I ever going to be able to take a breath by myself again? And then you get distracted 5 seconds later and can do it again. So it's actually something we take for granted for sure. So CCHS is most commonly caused by that genetic defect in that gene, located on chromosome 4p12. So approximately 90% of the reported cases of this are caused by heterozygous amino acid expansion on this part of the chromosome. These mutations are known as polyonine repeat mutations, PARMs. All of the known genetic mutations have autosomal dominant inheritance, meaning that if somebody has it, it's very, very likely that they're going to spread it to an offspring. Over 90% of these mutations are actually just de novo, meaning they came out of nowhere mutations. So it's really important, we say all this, to make sure that if there was somebody that was asymptomatic, meaning they have no symptoms, a first degree relative, we need to make sure we check parents and siblings for the genetic testing for the CCHS. Prenatal testing and genetic counseling should be offered to all affected families and any subsequent pregnancies. So the thing that we're talking about there in Italy with the patient where she's just going to sleep and she's not able to breathe, turning blue, actually having a hypoxia where their oxygen's getting too low, that's one part of this mutation. There's other aspects to this as well that are associated. There are things that are related to the eyes that are more common in children with CCHS. One study showed that ocular abnormalities were noted in 73% of children with that. And some of those deficits include things like strabismus or like lazy eye, convergence insufficiency, things along those lines as well. They're also been shown to have some association with certain learning disabilities, limitations in perceptual skills, vocabulary, and abstract reasoning. The range of neurocognitive functioning in these patients is quite wide. And again, this is very rare, but children with this are usually able to participate in age-appropriate classes, but often require some special educational and support services. So the biggest thing is that kids with this are at risk for developing episodes where their oxygen gets so low that it can become life-threatening, and they're triggered by certain things. Sometimes things like breath holding spells, which these tend to occur in young children triggered by fear or anger and sometimes require resuscitation by caregivers. Swimming should be avoided or undertaken only with really close supervision in these children. Underwater swimming is just really dangerous because breath holding may lead to drowning because they're just not able to get that sense of, oh my goodness, I need to come up for air. I need oxygen. That part of the brain that's telling them they need more oxygen is impaired. And then, of course, things that affect your central nervous system and depress it, like alcohol and drugs, definitely can make a big issue for people that can't control their respiratory rate. General anesthesia should be undertaken with caution because individuals with this may have delayed recovery. And so, yeah, you definitely don't want to be exposing yourself to any of these things. But obviously, while awake, patients can consciously control their breathing, but just again, like when they're asleep, that autonomic drive to breathe just vanishes, leaving them vulnerable to suffocation. This can be diagnosed much younger in infants, but it looks like in this story that we're bringing up here is probably more in an older child that may have had a less severe version of this or wasn't noted when they were very young and needing things like ventilation, ventilator support when they're in early childhood. Overall, this is just that chilling reminder that even something as simple as falling asleep or breathing can be deadly when the body's wiring just decides to betray you. So definitely a fun way to spend your Halloween podcast episode is learning about some of these stories. And I'm sure there's plenty more. I think that this would be a fun one just to keep, reading about.
Absolutely. There's a lot of great ones out there. The problem is a lot of the ones that are really historical, like, there's a lot of assumption. There's a lot of guess. They didn't necessarily check things or, there was a lot of historical muddling, I guess, of facts. So it's a little bit difficult to kind of give a clear medical picture. But I think if these cases really teach us anything, is that the human body is far stranger, far spookier than any horror movie could really ever make it.
I think that's a very, very real statement there. So that wraps up today's episode of the Med Edit podcast. If you're a clinician, check the show notes to claim your CME credit.
And as always, thank you for tuning in. Follow us on Instagram and TikTok at the Med Edit podcast and send us your ideas for future episodes. And happy Halloween.
Thank you for listening to the Med Edit podcast. Please click the follow button to be notified when more episodes become available. For more information about this episode and to find out how you can reach Dr. Cari Sorrell and Dr. Jessica Gray, please visit today's show notes. Be sure to follow us on our socials, Facebook, Instagram, and TikTok to stay up to date on all things the Med Edit podcast. The information and content has been made available for informational and educational purposes only and does not constitute a physician-patient relationship. If you need medical advice or help, please contact your personal physician. The views and opinions of the guests do not necessarily reflect the views of Dr. Jessica Gray or Dr. Cari Sorrell. This podcast should not be considered an alternative to medical advice or diagnosis or confirmation of an illness or disease. Please seek help from your personal care practitioner. Thank you for listening and tune in next time.